Good afternoon, and thank you for inviting me to speak at this International Cough Conference. My name is Weinberger. And my colleague is Dennis Buettner, who's Buettner. Is okay. And I'm going to talk to you about the cough without a cause. And the name of it is the habit cough syndrome. And I'm going to talk about it in both children and adults. So what we've seen is a child from India and an adult, both coughing. And this type of cough can go on continuously throughout the day. And its characteristic is that it's not present once asleep. And I'll talk more about this. So these are examples of people having chronic cough. They have no other underlying abnormality. And so this is examples of the habit cough syndrome. I'll give you some background. Cough, wheeze, and other respiratory noises are very common for people seeking medical treatment. Acute cough, of course, is very common from viral respiratory infections, common colds, asthma. Now, habit cough is a functional disorder. That means it has no physical cause, and importantly, there is no response to any medications. By definition, what is a habit cough? It's a daily, repetitive, non-productive cough that is absent during sleep. And that absence during sleep is a sine qua non, essential factor for making the diagnosis. It often is associated with a honking or balking sound, such as that first child, but the sounds vary with the patient. Now, habit cough falls into the category of what's called habit disorder, a variety of habit disorders. And what characterizes the habit disorder is there's repetitive unwanted behavior, it's involuntary, causes distress, functional impairment from it, and it can have negative physical and social consequences. The habit cough has been known in medicine for a long time. It's described, for instance, in 1694. And this is an example. They described a habitual cough that would start with a cold, and the cold would go away, and the coughing would persist as a habitual cough. Described also in an 1886, Charles Crichton described a habit cough, a reflex effect persisting after the cause is gone, or an acquired habit. And again, a habit can be an involuntary process. It went on to state the treatment of it is to break the habit. That was very insightful because it relates to a current process for treating habit cough to stop the stimulus caused by coughing that causes continued coughing. The first description I've seen in the literature of someone curing habit cough was Dr. Bernard Berman in his publication in 1966. He had seen 6 children over 5 years with a habit cough in his practice. Ages were 9 to 13, 3 boys, 3 girls. They had a barking cough, frequent and repetitive during the day, but was absent once asleep. Again, that is a sine qua non for diagnosing a habit cough. What he found is he could get the cough to stop with what he called the art of suggestion. He did consider other nomenclature other than habit cough because he had heard individual cases described as psychogenic or tics. It is obviously not a tic. A tic is a muscular movement. This is a cough, very different. And he concluded that it wasn't psychogenic because the kids were perfectly normal psychologically. They had no serious underlying psychological problems in those 6 children. And so we thought the term habit cough was most appropriate. My first publication was in 1991, but I'd been treating, and my colleagues and I at the University of Iowa had been treating habit cough since 1975 when I first came there. In this case, Dr. Lakshan watched me treat a 15-year-old girl who had had months of intractable cough. He was surprised when the cough stopped within 15 minutes of my talking to her using suggestion therapy. This was the kind of thing I had done routinely with patients, over the previous 25 years. He asked the logical question. Dr. Lakshan was a fellow of mine, and he asked, is the quick fix that he saw permanent? And so I did what one should do with fellows, and I told him, go find out. And so he did a manual review of previous charts, found 9 children with habit cough, age 6 to 17 years. They were routinely contacted 1 week after being seen. 1 had no symptoms, 8 had minor self-controlled symptoms. He then contacted them. They had been seen various numbers of years before. The median was 2.2 years later after the initial visit, and he was able to contact 7 of the 9. 6 had no symptoms. 1 had very minor self-controlled symptoms. The colleague, Dr. Lindgren, was a psychologist in our department, and so he gave the patients, the 7 patients could be contacted, a psychological test called the SCL-90R. It found no abnormalities in the 7 patients. Now let's talk about how often this happens, the epidemiology for children. We look back over a 20-year period that we had our electronic medical record that we could identify the diagnosis of habit cough. We found 140 diagnoses over a 20-year period at the University of Iowa. And for the last 12 of those years, we were averaging about 9 per year. A similar study was done at the Brompton Hospital in London. They had 55 patients with the same type of same criteria for diagnosis that we had, same types of patients. And over 6 years, they had 55, and that also was an average of 9 per year. So I think that gives us an idea that referral centers for children are likely to see about 9 per year of children with this habit cough. The mean age at both of our institutions was 10. Both genders were present, and 85% were between ages 8 and 13. But we did have some young ones. We had one of this series, age 4, and since then we've even had a 3-year-old, a very precocious 3-year-old. The cough can be present and was present for weeks, months, and years in these patients before we saw them, going on for a long time. In some cases, 18% had been going on for a year before we saw them. Diagnosis in all cases, both at the University of Iowa and at Brompton, was a repetitive dry cough absent during sleep. There are no tests needed to make the diagnosis. Secondary gain was hypothesized by some as suggesting it was a psychological thing, but in fact, secondary gain was not usually present. Psychopathology of any kind was not commonly present. Looking at those patients that we saw, coughing was observed in 85 during the clinic visit, and 81 of the 85 stopped with 15 to 30 minutes of suggestion therapy by the clinic physician. This was not always me. This was any one of my colleagues would stop. Autosuggestion, which was telling them to do at home what we could do, what we would do in the clinic. We taught that to all of those so they could continue therapy, suggestion therapy, while they're at home. And we also provided that for those not treated when seen in the clinic. We had some of our faculty that didn't want to do it themselves. They felt more comfortable giving them instructions to do it at home, and it was fine. Most of them still got better. What I'm going to show you now is a demonstration of the suggestion therapy. The first one that we did remotely. All the previous ones had been done with a patient right there in front of us. This is a remote one done by teleconference. And this had been put on YouTube.
I could do anything any kid could do before my cough. When I couldn't stop coughing, it made me really sad. Dr. Weinberger taught me how to make my cough go away in only 10 minutes.
Yeah. I told you, right? The total number?
Yeah. Well, we don't want to keep count of them. We just want to.
No. She wants to tell Hunter. Shh, tell him. Look.
So this girl has been doing this for 3 months.
I planned on recording audio only, but about 3 minutes in, I realized something really incredible was happening.
And this is her
I
father
picked up
talking.
my wife's phone and I began to film because no one would believe what we were about to see.
Great girl. You've done it. Over 3 minutes. Hey. Don't. Once you cough once, try not to let it happen again. Try and hold it back because that causes more irritation and makes you cough more. But you did it for over 3 minutes. Okay. Did it get a little bit easier that time?
Mm-hmm.
Still hard though, huh? Okay, we're gonna go for 4 minutes now. Yeah. Okay. You're doing it. You're doing great. You went 3 minutes before you coughed.
Mm-hmm.
So I'll bet you can do 4 minutes too. So full therapy is up here, and you can access that. You're letting it control you. For the sake of limited time, I'm going to go on. Important thing is we took that video where the girl, her name was Bethany, she stopped coughing, and her father put that on 2 places on his own website called habitcough.com and on YouTube. People started finding that because they would search they had chronic cough that was being not satisfactorily dealt with by their physicians, they would search the internet and find one of those sites. And from that, we found something that was unexpected and unintended. We published that brief report, and we found that people watching the video reported to us that their cough stopped. We call that suggestion therapy for habit cough by proxy. No person was involved, only the video. This is an example. This was an email, one email that we received, and the mother says, describes her daughter, Riley, 7 years old. A few months back, she had a really bad cold, which led to a bad cough. After a few weeks, the cold symptoms went away, except for that cough. Just like in that 17th century one I showed you. She said there was no stop to it, just so much coughing. They took her to doctors, nothing helped. And then she went on to say, I finally decided to just pull up your video on YouTube. And we all sat there and watched it. It was very emotional for all of us. And at the end, Riley was in tears. We all were. We hugged for a time. She said to us, I can hold the cough back. And then the coughing stopped. Like turning off a switch, the mother says. And for the subsequent 4 days, she said, there was no cough. The cough was gone. Now, the video was seen by a lot of people. And we took advantage of the fact that some of the parents who saw it were bilingual, and they offered to help us make the video appropriate for those who spoke their native language.
好，接下来做2件事情，很简单。第一件喝水，第2件呼吸。好的，在这个过程当中，请一直看着我，听我的指令，哪怕是当你想要咳嗽的时候。
So let's talk about the natural history here. We've treated a lot of children over the years, and some adults reported that seeing the video enabled them to stop coughing also. So let me show you the natural history of habit cough in children if there's no suggestion therapy. This is from Mayo Clinic. They looked into their archives and they found 62 children with what they call the involuntary cough syndrome. So these were from their archives. And they're in the past, their practice had been just counseling. And they had a follow-up of those 62 patients, a mean of 8 years after they were seen. Ages were 5 to 16, median age was 10 years, the same as we saw in Iowa and as was seen in London, England, the Brompton Hospital. Mean cough duration until the diagnosis, until they saw the patient, had been 8 months. So these are patients who had a chronic cough for an average of 8 months in those patients. 75% did have spontaneous resolution, but the mean of time for that spontaneous resolution was 6 months. And 25% were still coughing an average of 6 years from the time of diagnosis. So this is not a benign disorder. How about in adults? What's the natural history in adults? Well, we don't have the kind of information in adults that we have in children, but we know from histories and talking to adults that some have coughing prolonged, not just for months after an upper respiratory infection, and some of those do have it repeatedly after upper respiratory infections, but others have prolonged coughing for years. And importantly, of adults who have chronic coughing for years, I'm showing here 3 review articles described that over 40% of those adults with long-standing chronic cough are refractory. That means they don't have a diagnosis that is treatable, and they've had trials of all sorts of treatments and tests, and they don't respond. 27 adults have seen the video and serendipitously found that they could self-identify that their cough stopped. These were emails that were sent to us among 27 adults. Another 22 adults were identified on social media who had seen the video and reported it had a positive effect on them. These were not ones who communicated directly with us, but these were essentially anonymous statements after seeing the video. And this shows us what the results we have of suggestion therapy by proxy. Patients who have seen the video, and from the video, they were able to stop coughing. The red dots are children, the blue markers are adults, and this has happened throughout the English-speaking world and in a few countries that the individuals may have been English-speaking, but the area is not. And to expand the number of people who have access to seeing the video, we now have voiceover eyes in German, Mandarin, North Macedonian, Spanish, and Turkish. And so, what's the take-home message? Daily repetitive dry cough absent during sleep is a habit disorder known as the habit cough syndrome. Habit cough is a daily troublesome cough that occurs in both children and adults. A habit cough can last for months and years. Habit cough responds to no medication, but it does respond to suggestion therapy. And the suggestion therapy can be given by direct contact, as we did for years in Iowa, by teleconference, as I demonstrated, and by proxy from those viewing a recording of the teleconference. So thank you for your time, and that's all for today. Any questions?
A journey of 1,000 miles begins with one step. The repetitive barking cough that is not present once the child is asleep is the diagnostic criteria. While cough may interfere with falling asleep, the cough gone once asleep is the diagnostic sine qua non for this peculiar disorder.
I have no idea what it comes up.
Hi, I'm Bethany. I'm 12 years old. I could do anything any kid could do before my cough. When I couldn't stop coughing, it made me really sad. Dr. Weinberger taught me how to make my cough go away in only 10 minutes.
Yeah. I told you, right? The total number?
Yeah. We don't want to keep count of them. We just want them to
No. She wants to tell Hunter. Shh, tell him. Look. We kept a precise diary of every event during this horrible time. We're releasing it out onto our website so that anybody can look at it also to see if they feel that they fit the criteria of this terrible habit cough. We eventually ruled out everything, working with our doctors, trying to figure out what this was. One of our doctors early on said, "Tell your body to stop coughing," but that's all she knew. There was no other information available at the time. As you see here, we ruled out basically everything over the counter, and we even looked at GI, reflux. We even checked her saliva, which wound up to be in a good range. We were at wit's end. We didn't know what to do. Then after 3 months, we had a huge find, habit cough in adolescent children by Dr. Berman. And it was such a relief. We're like, wow, somebody knows. Through more research, we wound up tracking down Dr. Anbar out of upstate University Medical. And I sent him an email, and he was the first person to mention Dr. Miles Weinberger. As luck would have it, I found Dr. Weinberger's email address. I sent him an email with our diary, asking him if it might help him in some way. He actually sent me an email that I saw right when I got home, and he said, "Call me tonight." And he had this awesome paper, The Habit Cough, how to diagnose it and to treat it. We were blown away. He actually said, "Call me." I called him, and he asked, "Does Bethany wake up with the cough in the middle of the night?" I said no. He knew right then and there that it had to be habit cough. We arranged for him to Skype 2 days later. He wanted Bethany to be there with a glass of water, ready to concentrate. What you're about to see shocked and amazed us. I planned on recording audio only, but about 3 minutes in, I realized something really incredible was happening. I picked up my wife's phone and I began to film because no one would believe what we were about to see.
Great girl. You've done it. Over 3 minutes. Hey. Don't. Once you cough once, try not to let it happen again. Try and hold it back because that causes more irritation and makes you cough more. But you did it for over 3 minutes. Okay. Did it get a little bit easier that time? Still hard though, huh? Okay, we're going to go for 4 minutes now. Yeah. Okay. You're doing it. You're doing great. You went 3 minutes before you coughed. So I'll bet you can do 4 minutes too. Yeah, you can do it. Okay. So just keep thinking, keep concentrating. Yep, you got to concentrate because you've got to be aware of what's making you cough. Because it's kind of automatic, but it's kind of like breathing. Yeah, you don't have to think about breathing, but you can control your breathing if you want. You can hold your breath, you can breathe more. Right? Remember what I said, you start feeling that, take a slow, deep breath, because it helps a little bit too. And in addition to sipping a little bit of water. Great. Great. Have you ever had a mosquito bite? No? You never had a bug bite? Never had anything on your skin that itches? You ever noticed that the more you scratch it, the more it itches, and you have to stop scratching it? This is kind of the same thing. The more you cough, the more it causes that feeling back there that you have to cough again. And just like you have to stop scratching something in order to heal up and stop bothering you, you've got to control the cough, which is harder than not scratching. I'm not saying this is an easy thing to do. If it was an easy thing, we wouldn't be here. It's hard because it goes on and on and on. But what you're doing is learning to hold it back, even for a little bit. And the longer you can hold it back, the easier it's going to get. You've got almost 3 minutes now. Almost. And you get 1 more minute. Okay? The longer you can hold it back, the easier it's going to get. But it's hard to do. It takes a lot of concentration. Don't let your mind wander. Your mind wanders, and this automatic cough's going to come again. So you got to keep thinking about it. Kind of boring, but it's important. Hang on there. Keep thinking. Yeah. Slow deep breath too. Slow breath. Good girl. You're doing great. Another 20 seconds, you'll have gone 4 minutes. Okay. Slow deep breath. Make that, control that annoying feeling. And that feeling has occurred because of this very long period of you been coughing. I'll look back. Okay, you've gone 4 minutes. You're doing well. Hang in. Keep concentrating. Keep concentrating. Guys, we're going to go 5 minutes next. 5 minutes. Slow breath. Relax, but keep focused on me and think of nothing else but being aware of it before it coughs. Be aware of what you're feeling before. And when you feel it, take a slow, deep breath. Take a sip of water, but keep controlling it. Good girl. Good girl. Okay. Deep, slow, deep breaths. Relax. And just keep listening to me and stay focused. Think of nothing else. Okay? You're going to do 5 minutes, and I'm sure you can, right? Because you did 4 minutes. If you can do 4 minutes, you can do 5 minutes, can't you? Right? You can. But it takes a lot of brain power to do that, doesn't it? Yeah, I know. It's hard. Okay? So you keep thinking, keep concentrating, take some slow, deep breaths. Real slow, real slow. Real slow. Very slow. Relax. Stay relaxed. You're doing great. You're doing great. Stay focused. Keep your eyes on me. Don't look anywhere else. Don't think of anything else. You gotta keep your mind working on one thing. On one thing. And that's not responding to that feeling there. I'm not going to do that. You're doing, hang on. Good girl. Good girl. That's right. That was hard. You're feeling it there, right? Take slow, deep breaths. Slow, 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 slow. Right. Okay. Concentrate. Keep your mind focused on that one thing. Don't think of anything else. You're getting all your brain power on one thing, because you've got a lot of brain power, but usually it thinks of a lot of things. So right now you're not letting it go anywhere else except concentrating on when you feel that. Hold it back. Take a deep breath, sip a little water. Yeah, that'll help. But the main thing is using your brain to hold it back, to control. You're going to take control. You're not going to let the cough take control. Because you're smarter than the cough, aren't you? Yeah. You're doing great. Hang on. It's hard. It takes a lot. Hold it back. Good girl. Good girl. Hard thing to do. So, you really have to concentrate. Okay, you're doing well. You're doing well. Okay. But the longer you go, the easier it's going to get. The longer you can go, the easier it's going to get. Okay? It's still going to be there. It's not going to go away completely. Not for a day or so, because you've coughed for months. So you've irritated it back there. You've bothered it. And that's what's causing the cough. But if you can stop it from happening, it's gradually going to heal up. And you won't have to cough like you have been. 20 seconds, it'll be 5 minutes. Hey, you can go that much longer, can't you? Yeah. Okay. Yeah. Okay. Feeling it now, but take slow deep breath. Slow deep breath. Good, you're good at this. I can tell you're good at this. Okay, you've gone 5 minutes. You've gone 5 minutes. We're going for 6 minutes now. Okay, you've gone for 5 minutes. Still there, right? Okay. Slow deep breaths. Slow deep breaths. Okay. Keep concentrating, because the longer you go, the easier it's going to get. It's getting a little bit easier now, isn't it, to hold back? I saw it was going to come out there, and you did a good job of holding it back. And that's what you got to do. Your brain has to be the boss here. You have to be the boss, not the cough. Cough is kind of automatic. It just happens without you thinking about it. But if you think about it, you can hold it back. Not easy, but you've been doing it. You've done it for 5 minutes, and we're going into 6 minutes now. Okay. Keep concentrating. Think of nothing else but holding back. Think of nothing else, and take slow, deep breaths when you start feeling anything. Good girl. Hey. Hey. You're going to send that cough packing, aren't you? I'm sure you will. Okay. Now that feeling isn't going to go away completely, but not for a day. What you're doing is learning how to take control and not have it keep going, because the more it coughs, the more it's going to cough. The cough causes the cough. So if you can hold back the cough, if you get your brain to do that, it's going to gradually get better. You're doing great. Nice slow breaths. Relax, but stay focused on me. Keep thinking of nothing but the cough, not the feeling that you're holding it back. The feeling of holding it back. And you keep holding it back. Okay, keep doing that. getting the feeling. Take a slow, deep breath to relax. Slow, deep breath. Keep looking at me. Slow, deep breath. Great. Okay. Keep focused. Remember, it's the cough that's been causing the cough. The cough causes more irritation there, and it's irritation that makes someone cough. And so you have to break the cycle. You have to break the cycle. You're doing great. Keep holding it back. Keep holding it back. Slow, deep breaths. Keep concentrating. Yeah. You're doing great. You're very good at this. You're very good at this. But it's working, isn't it? You're able to hold it back longer. Each time you're able to hold it back a little bit longer. Okay? And we're going for 7 minutes this time. 7 minutes, and you're doing it. In 7 minutes. Great. Keep concentrating. Very boring, I know. Just have your mind on one thing. But it's important, because that's the way you get control of something that your body wants to do. And that's what you're doing. You're taking control. You're going to say, yes, I've got that feeling that I have to cough, but I'm not going to let it happen, because I'm the boss. Okay. Slow, deep breaths. Slow, deep breaths. Right. Keep concentrating. Great, you're doing it. It's fantastic. Fantastic. You're really good at this. You're getting there. You're getting there. Yeah, because the longer you go, gradually it's going to get easier. And it's getting a little easier, isn't it? It's not gone yet, but it's getting a little easier to hold it back. And that means your brain is controlling it instead of just letting it happen. Okay. Good girl. Good girl. Okay. Yeah. This is not a real common problem that you have, but you're not the only one in the world that's at it. Mm-hmm. I've seen a lot of other kids with this. It used to be about 7 a year in our clinic, so that's not common, but it happens. Okay. And this is what you have to do to get it under control, to get your brain to take control of what your body is trying to do when you're not thinking about it. And slow, deep breaths and concentrating. You've gone 7 minutes. We're going for 8 minutes now. Okay. You're getting there, aren't you? Yeah. Feeling you've got a little more control over it now, huh? Yeah. Okay. So we're going for 8 minutes. Great. Just hang in. Keep concentrating. Keep saying, I can control that. I can control it. I can feel it, but I'm going to not let the cough happen. I'm just not going to let it happen. I'm not going to let it happen. Take a slow, deep breath when you need to, if you feel anything. Good. Yeah. You're doing great. You're on your way to an addition to the 7 minutes. And you did 7 minutes in addition to 6 minutes. So you've done 13 minutes already. That you've held it back. Yeah. And you're going to keep doing it. Because the longer you do it, the easier it's going to gradually get. The longer you do it, it's gradually going to get. It's not going to make it feel it go away right away. It's like a bite that you've been scratching. It takes a while to heal up. But until you stop scratching, it doesn't heal. It's the same thing until your brain learns to control that cough and not respond to that feeling. It's going to keep happening. Good girl. You're feeling it now, huh? I can tell. I can tell when you're feeling it. And that's when you've got to really concentrate. That's when you've got to really concentrate. Yeah. Slow, deep breaths. Slow, deep breaths. Slow, deep breaths. You know, when you add up the different times, it's getting to be over 20 minutes since you coughed. And that shows you can do it, right? Not easy. We're going to go longer because the longer you go, the easier it's going to get. The longer you go, the easier it's going to get. That's what you have to be thinking about, because you're controlling it. It's not controlling you. You're the boss. Your brain can control it, not just respond to that feeling. Okay, good girl. Okay. You're doing fantastic. You're really doing well. Feeling is still there, but you've gone more than 20 minutes controlling it. Okay, we'll keep going a few more minutes because I want you to keep controlling it. Because keep in mind, you're the one that's controlling it. I'm not doing anything except teaching you what to do. You're the one doing it, which means you can keep doing it even if I'm not there, right? I think you can. Because what we're doing here, you can do on your own later if the feeling is still there and starts bothering you. And if you do this, if you keep thinking about it, again, the longer you go without coughing, the easier it's going to get. And after a day or so, that feeling's going to go away as it heals. Like a bite that's itchy, you just got to heal up. It takes a little while. So keep some water around. Keep some water by your bedside. And remember the slow, deep breaths. When you're feeling something, you do something else other than coughing. You say, I'm not going to cough. I'm going to take a deep breath. I'm going to sip a little water. I'm just not going to cough. Okay? Because you can control it, right? You've been doing it. So you know it can be done. You know it can be done. And that means anytime it starts happening, you think about it. You can control it. It's when you're not thinking about it that it happens by itself. You're still feeling it, but you're controlling it. Remember the slow breaths too. So, again, nasty feeling is there, huh? But you're controlling it now. It's not controlling you. Okay. You've gone almost half an hour now. I think you can keep doing it on your own now, can't you? I think you can. Yeah. So what I'm going to do now is I want you to keep thinking of your own. Okay? Keep thinking on your own. Okay? Slow breaths. Okay. Don't let that feeling make you cough. Because you know you can hold it back. You've done it. You've done it for half an hour. So you can do it. Not easy. But you're showing you can control it. Okay. 6 slow breaths. Slow, deep breaths. It's bothering you, isn't it? Yeah. But you're controlling it, even though it bothers you, because you're taking control. You're not letting it control you. Okay? So this is what you have to keep doing. You may have to do it for a while. It's going to gradually get easier. Gradually gets easier. Keep thinking about it. Hold it back. Good girl. Keep looking at Mel when you and take a slow deep breath. Slow deep breath. That helps a little, huh? Taking the slow deep breath. Okay. Okay. I think you can do it yourself for a while now, can't you? Okay. Let me talk to your mom and dad, but you keep thinking by yourself. You keep control. Mom and dad, are you there?
Yes. So here we are, Dr. Yim's office. What did we do today? And she can't talk a whole lot because she's still still recovering. So yeah, and she has to cough right now. And hold on. What do you do? Do that.
Don't cough.
Right? Great job. Let's walk. So we're going to go and have a treat. So Dr. Yim was wonderful. You did a great job. No, I don't want you to. Dr. Wein? No, try not to. No, try not to. Take it. Do one. All right, what? One more minute. Hold on. I'll tell you when time's up. Take a sip of water. One more minute. I'm always going to say 1 more minute. Okay. You're allowed to do a couple extra. That was only 6. Normally it's 12. Still good. You cut it in half, okay? Good girl. How do you feel? Ugh. So Dr. Weinberger said, just shave off a little bit, basically. That's my words, but he said if you're going to cough 12 times, only cough 6. And then you cough 5. What you doing?
Taking my medicine.
What's your medicine?
If you start feeling anything,
Oh, great.
Thank you for teaching me how to make my cough go away, Dr. Weinberger. If I can do it, you can do it too.
On our way home from Dr. Yim's visit, Bethany saw the sign and yelled, "Daddy, turn around." Wow. Follow your steps and drink your water, just like Dr. Weinberger said. Dr. Miles Weinberger, you certainly are miles from ordinary. The goal she reached is to be a flower girl in her friends' weddings and more.
My full session with Dr. Weinberger is on our website at habitcough.com.
Please be advised, this was our experience with Dr. Weinberger. Yours might certainly differ, but talk to your pediatrician, talk to your pulmonologist, talk to your child's doctor, and let them know about habitcough.com.